What if, when I check for crowning, I see the umbilical cord? A prolapsed cord is a rare presentation that must be treated in the hospital. Cord prolapse typically occurs early in labor when the amniotic sac ruptures, but it is still an extremely time-sensitive emergency. This situation is dangerous because the fetus's head will compress the cord during birth and cut off circulation, depriving the fetus of oxygenated blood. Call for ALS backup. Do not try to push the cord back inside the vagina, and never cut the cord. Cutting a prolapsed cord will cause the baby to suffocate inside its mother. Your job is to keep the fetus's head from compressing the cord. Place the pregnant woman supine with the foot end of the stretcher raised 6 to 12 inches higher than the head, with her hips elevated on a pillow or folded sheet. Alternatively, the woman may be placed in the knee-chest position, kneeling and bent forward face down. Either of these positions will help keep the weight of the fetus off of the prolapsed cord. Carefully insert your sterile gloved hand into the vagina and gently push the fetus's head up and away from the umbilical cord. This is only one of 2 situations in which you should ever place a hand or finger into the vagina. Maintain this position and continue to keep the pressure off the cord continuously throughout the transport to the hospital and possibly until the patient is in the operating room. Wrap a sterile towel, moistened with saline, around the exposed cord. Administer high-flow oxygen and transport rapidly. What if I see the baby's butt? We just talked about how a prolapsed cord was one of only 2 situations where you ever place a hand or finger into the vagina. Well, this is the second situation. A breech presentation is when the buttocks are delivered first. With a breech presentation, the fetus is at a great risk for trauma from the delivery. In addition, a prolapsed cord is even more common in a breech delivery. Breech deliveries are usually longer than a normal delivery, so there may be time to get the patient to the hospital. If the buttocks have already passed through the vagina, however, the delivery has begun. Call for ALS backup. Generally, if the woman does not deliver within 10 minutes of the buttocks presentation, provide prompt transport. However, you should consult your medical control to provide guidance in this difficult situation. Prepare for a breech delivery the same way you would for a normal delivery. Allow the buttocks and legs to deliver spontaneously, supporting them with your hand to prevent rapid expulsion. The buttocks will usually come out easily. Let the legs dangle on either side of your arm while you support the trunk and chest as they are delivered. The head is almost always face down and should be allowed to deliver spontaneously. As the head is delivering, you will need to perform a potentially life-saving procedure to manage the newborn's airway. Make a V with your gloved fingers and position them in the vagina to keep the walls of the vagina from compressing the fetus's airway. What if I see the baby's hand or foot? This is called a limb presentation. This baby cannot be successfully delivered in the field. These fetuses must be delivered surgically. If you encounter a limb presentation, you must transport the patient to the hospital immediately. Cover the limb with a moist, sterile towel. Never try to push the limb back in or pull it out. Place the patient on her back with her head down and pelvis elevated. Because the woman and fetus are likely in distress, remember to apply high-flow oxygen. What if I see a water balloon? If the amniotic sac has not ruptured by the time the fetal head is crowning, it will appear as a fluid-filled sac emerging from the vagina. This situation is potentially life-threatening for the fetus because the sac will suffocate the fetus if it is not removed. If the sac has not ruptured spontaneously, you may puncture it with a clamp or tear it by twisting it between your fingers. Make sure that the puncture site is away from the fetus's face, and perform this procedure only as the head is crowning. Do not puncture the sac if the fetus's head is not crowning. As the sac is punctured, amniotic fluid will gush out. Push the ruptured sac away from the fetus's face as the head is delivered. Wipe the mouth and nose with gauze. If the airway is obstructed with fluid, clear the newborn's mouth, then nose using a bulb syringe.